Hi, I'm Rick Howells. I'm Senior Vice President of Network and Business Development for Heritage Victor Valley Medical Group. Purpose of this talk is to really help you as a consumer of healthcare to become more aware of what questions you should ask while you're shopping or comparing health plans and how it relates to straight regular Medicare and these other things called Medicare Advantage health plans. There's always this period of time each year between October the 15th till December the 7th. It's called the annual enrollment period. And that's when we all get bombarded with so many different ads from television, radio, and even on social media when you're out on different websites and looking at different applications. Most of those are going to be a broker projected image or a conversation with a broker. And brokers are very important to this process, but I want to tell you what a broker does. And really, a broker is going to give you more advice about whether you're eligible for Medicare or perhaps you're helping, a parent or grandparent or a friend and who's eligible and when they can enroll in the different products. So I want to talk to you a little bit more about the nuts and bolts behind how these things work and the pieces that really aren't always talked about when people are selling these different products to you or talking about them. So I'm not selling anything, but the intent today is really to help you become a better consumer, like I said. So let's talk about what I call alphabet soup. They're going to talk about Medicare Parts A, Medicare Parts B, D, and C. Well, Medicare Part A is really your inpatient care. This is your hospital coverage, hospice coverage, skilled nursing coverage, and home health coverage. These are your benefits under Part A. Part B, as in boy, are your outpatient services, and these are the ones we're more commonly knowledgeable of and utilize the most. These are your doctor's visits. When you go to a lab, you have x-rays taken, maybe what we call DME, which is durable medical equipment, like your walkers, your wheelchairs, maybe you need oxygen. All of those under Part B is in boy. Now, Part D, that's just your prescription drug part. Regular straight Medicare really only provides you Part A and Part B. Then you see this thing called Part C on TV quite often, and that's Medicare Advantage. And what Medicare Advantage is you basically are assigning your Medicare benefits, if you're an eligible beneficiary, over to a health plan who's providing you a benefit package. Now, those health plans must provide the same benefit package as Medicare or more. The or more is where they like to promote themselves as a health plan. That's where you pick up things like some basic dental coverage, maybe you're getting chiropractic care coverage, transportation benefits, and vision coverage, and some other things that aren't really covered under regular straight Medicare. That's Part C. So I call it government math. C equals A plus B plus D most of the time. Some of your brokers are going to talk to you about PPO plans and HMO plans and what the differences are. Most of my talk's going to really be around the HMO version of Medicare Advantage health plans. So let's talk about contracting hierarchy. That's what I like to kind of run through how this all fits together. And again, I want to tell you about the nuts and bolts of these things, how it works. It's typically not the discussion you hear from salespeople. Again, I'm not selling you anything. This is for your own information so you can be a better consumer of healthcare. So it starts at the top, CMS, which is the Center for Medicare and Medicaid, or what you might call them the federal government. They contract with all of these health plans, and we call them MA health plans. Medicare Advantage is what MA stands for. So that's, there's a whole variety. With our group, we actually contract with 15 different health plans, but it differs depending on what state you might be in, what zip code you're in within those states. And then it goes from CMS to the health plan, but the health plan contracts with things called medical groups. Sometimes you'll hear IPA, which is Independent Physician Association, still medical group. That's the part I want to give you more information about because it's typically not talked about and how that fits into you as a patient or a member of a group and how that even happens. The medical group actually contracts with all of the providers, your doctors, your radiology providers, maybe your hospitals, all of the people that might render healthcare to you. So you can see there's this relationship contractually. It's very confusing for people sometimes. They'll say, oh, I have ABC Health Plan and I have Dr. Jones. How's this medical group fitting in here that are reaching out to me to talk to me about certain things? You become assigned to a medical group almost transparently to you. One of the bases of being in a HMO or even a PPO is you as a beneficiary have to choose a primary care physician. A lot of times you'll hear people call it a PCP. Again, back to that hierarchy, who's that doctor contracted with? He or she is contracted with a medical group or an IPA most of the time. That's where you end up being assigned to a medical group. You choose ABC Health Plan, you choose Dr. Jones, you kind of transparently become assigned to this medical group that Dr. Jones is a part of. The medical group is actually the administrator of your benefit package that you set up with the health plan that you choose. That's where it gets a little confusing sometimes. What's a medical group do? Well, we have two different types. And this is kind of more than maybe you need to know, but I want to explain it so you're more aware as a consumer. There are full risk groups, which means that health plan that contracted with that medical group has delegated all of the financial responsibility to that medical group, with maybe the exception of your actual pharmacy or Part D as in dog benefit. So your medical group could pay all of your claims, whether it's hospital Part A benefits, outpatient services that are Part B as in boy, like your doctor's visits, your radiology, labs, all of those things. Your medical group's also going to do your referrals to specialty care. And that's where sometimes an HMO setting gets a negative perception from people. And that's why I like to point out what a medical group does, because usually, like I said, you're choosing a doctor, you're choosing a plan. The medical group, though, is a key component of all of your health care. They're kind of navigating the whole healthcare system for you and helping you get through it. So they do things like case management. Say you're admitted to a hospital and you're in a what's called a full risk group, like the group that I work with. We will actually have case managers, which are nurses, uh, calling you, calling your family, helping you set up what we call transition of care. You get discharged from the hospital. Well, is there follow up care involved? And what happened to you that caused you to even have that hospital stay? Do you need equipment such as walkers or canes and crutches and oxygen after you get out of the hospital and you're home? That case manager will help set all of that up. And in our group, we typically have all of that in place before you're even discharged from home. The case managers will also set up home health care for you after you get out of that hospital situation or after you're out of a skilled nursing facility. Are there people that are going to come to your home and do assessments with you, maybe help you with physical therapy and do other things to make sure that you're progressing and recovering from that hospital stay and the reason that you were in? We do a lot of health education. Maybe you have diabetes or you have a chronic kidney disease. We have a health education manager or advocate that helps walk you through really disease management and how you can best cope with whatever that chronic condition is that you have. Uh, One of the biggest things, though, and this is where it sets you apart in a Medicare Advantage plan from regular Medicare, you get a local member advocate. If you have just regular straight Medicare, you might turn over that Medicare beneficiary card and you'll see a toll-free number on the back. Say you need help figuring out, well, I need an endocrinologist. How would you know what endocrinologist is in your area, who you can go to? So you might call this person on the back of that card, and they're called an ombudsman. Well, in regular straight Medicare, an ombudsman might not even be in your area. They may not even be in your state. So how familiar are they really with the providers that are available to you in your area where you reside? Well, if you join a Medicare Advantage plan and you have this medical group that's assigned to you, they are very familiar with all of those providers that are available to you because they're contracted with that medical group. They have a relationship. They might be able to get you in when maybe you called and they say, oh, next available appointment's in 4 months. You call that local member advocate that works at your medical group, and they have that relationship with those providers, they can help ease that and get you in sooner quite often. Um, Additional benefits, a medical group can even bring a whole nother layer of benefits. Again, if you're in a Medicare Advantage plan, they must give you the same benefit package or more as regular Medicare. A medical group can bring additional benefits on top of that. We might do things like senior programs. We do bus trips. We do a lot of socialization activities because socialization is kind of a clinical component as well. We help stave off depression by getting people active, interacting with other people, and really what's best for all of us is to keep moving as best as we can quite often. So additional benefits that we do in our group, we have a lot of classes like Tai Chi classes, maybe it's chair exercise classes, jewelry, making jewelry, making different crafts, but it's about socialization, giving people a purpose for the day, getting you out and getting you active. That's a benefit of the medical group, and that's where it varies from medical group to medical group. Again, you choose a doctor, you automatically become assigned to a medical group because of that doctor's contract affiliation with a group. The groups will vary. Who really does good referral process? Or is it a difficult group to get a referral to a specialist with? This is the part that never gets compared and rarely gets talked about, but it's critical to the care and of you as a beneficiary. Again, the medical group is the administrator of your benefit package on behalf of the health plan. So, what about cost? Cost is always a variable we want to look at, especially as consumers of healthcare. Whether we like it or not, every year we are consumers of healthcare. You go through that annual enrollment period. Maybe you're still on commercial, or maybe you're what we call aging in. You still work, but you became 65, or maybe you were working and became permanently disabled and you're not 65, but you're now eligible to become a Medicare beneficiary. Well, the cost under regular Medicare, there's a deductible under Part A, which is a per episode of care. So, say you're admitted to the hospital. There's a Part A deductible under regular Medicare in 2026 that's going to be $1,736. What does per episode of care mean? You mean it's more than once a year? That's exactly what I'm saying. An episode of care in Medicare terms is the date you're admitted to the hospital until 60 days after your discharge from the hospital or the skilled nursing facility. That's the episode of care. So say I had a heart attack in January. I was admitted to the hospital. I come out of a 2-week stay at the hospital or whatever length of time that is. They admit me to a skilled nursing facility or a rehab facility before I go home. That episode of care goes all the way until you're discharged from that rehab or skilled nursing facility until 60 days after. That's your episode of care. Now we get to June and I have another problem. Maybe I fell and I broke my leg. It's a whole nother episode of care, and under regular Medicare, you have to pay another $1,736 for that second episode of care, so you can see how that could add up during the year. In a Medicare Advantage plan, most of your Part A benefits are going to have zero copay, with the exception of skilled nursing facilities. Again, these will vary by plan, which is why you need to be an informed consumer of healthcare to ask these kinds of questions. What does it cost me? Those first 60 days in a skilled nursing facility cost me zero under every one of those Medicare Advantage plans. But what about day 61 until day 100? That's where you need to do some comparison. Those dollar amounts will vary from plan to plan, and that's why you want to talk to a broker and ask these questions. What are the dollar differences to me, the payer, the consumer, and my out of pocket? Now, Part B is in boy under regular Medicare. There is a deductible as well. In 2026, it'll be $283. So that means you're incurring the first $283 of cost. And then there's a 20% coinsurance, it's called, which is your portion of all of those bills that you might incur from your doctors, from your labs, from your x rays. There's a Medicare allowable rate for each procedure, and you would be responsible for 20% of that allowable rate while Medicare pays the 80%. Now, under a Medicare Advantage plan, your Part B is typically going to have a lot of different copays based off of the service. You'll hear $0 copays. You'll see it on TV for doctor's visits. That's very typical in most of Medicare Advantage plans. You go to a specialist, also usually a zero copay under Medicare Advantage plans. But again, it varies state to state, zip code to zip code. Comparison point for you as a consumer. Things like ambulance rides, there'll be a copay. That varies from plan to plan. Most of the plans are similar because they are competitors with each other. Now, under regular Medicare, there's also something called a premium. Monthly payment you need to pay to have that kind of insurance coverage through regular Medicare. 2026, it's going to be $202.90. Now, this does vary from beneficiary to beneficiary, depending upon when you enrolled and became a beneficiary of Medicare. So if you're new to Medicare in 2026, $202.90 is going to come out of your pocket every month for you to have Part B coverage under Medicare. Typically, that's going to be deducted out of your Social Security check if you're collecting Social Security. So you don't have to literally write a check each month, but your Social Security check will be reduced by $202.90. Then you get to what I call Part D, as in drugs. That's not even part of regular Medicare. And a lot of brokers will talk to you about a product that's really a carve out or a add-on benefit for Medicare, and it's only coverage for pharmaceuticals and prescription drugs, which is fine if you want to have the flexibility. And this is where a Medicare Advantage plan sometimes is not the first choice for people because it thinks it limits. Like I said, that medical group's going to help direct you to specialty care. Well, they have a network. Regular Medicare, there's not really a network. It's who takes Medicare. And that's the attraction for a lot of people. Well, I can go anywhere. Maybe I have two different residences and I move from one area to another quite often during the year. So I don't want to be locked into a network. But again, there's a cost for that freedom. And you don't have the drug benefit. If you choose a Medicare Advantage plan, the drug benefit Part D is always included, but there are some copays, and they're called tiers. So your tier 1 drugs are typically all your generic drugs. Typically, there's no copay for a tier 1 drug. But this is where you, as a consumer, need to talk to a broker. A broker can actually pull up all of the different plans you want to look at, tell you exactly what drugs you're on and how much it will cost you under each one of those plans. They may be in different tiers from plan to plan to plan, and every tier has a different copay amount or no copay amount. Another comparison point for you as a shopper of healthcare. So, Medicare versus Medicare Advantage. That's really what I wanted to highlight today. Personally, if you're in a very populated area such as Southern California, like we are here in the high desert, there are many options available to you. You'll hear people like Joe Namath on TV talking about what's your zip code? Call and tell us your zip code. The reason they do that is some of these plans, that Part B premium, they're actually reimbursing under their plan benefits. And they will talk to you about that if it's available in your zip code area. You might have many, many options to pick from for a Medicare Advantage plan. A broker might talk to you about a PPO, which gives you a little bit of flexibility to go to other people outside of the network. You have HMO benefits and what are called PPO benefits, which are basically in-network benefits and out-of-network benefits. So again, be aware of these things. I want you to be aware of these things so you can ask these questions. A broker's critical to you enrolling, but you need to guide the conversation so it's beneficial to you as a consumer. What works for your neighbor Betty may not be the best choice for you. Again, what are Betty's conditions? What drugs is she on versus what your conditions are? What medications you might be taking? You want to find out what your out of pocket is for 2026 or whatever year you're looking at to purchase health care. So I hope this helps you ask better questions, be a better consumer of healthcare. When you're looking at choosing a primary care physician and you happen to live in the high desert here in Southern California, it would be wonderful if you chose one of the primary care physicians in my group, which is Heritage Victor Valley Medical Group, and we'll give you the best possible care in this area. But again, depending on where you're at, just educate yourself, be a great consumer of healthcare. Thank you for your time.